What's going on, everyone? Welcome back to my channel. In today's video, we're going to be looking at 4 exercises for a pinched nerve in the neck or nerve pain that's radiating down one of your arms. So if you have that going on right now, stay tuned for today's video. Before we get into the exercises, it's really important to know that when people have this feeling of having a pinched nerve in their neck or nerve pain that travels down one arm, in most cases, the nerve isn't actually pinched. Even though we use this language and you hear it from some practitioners, usually the nerve isn't actually being pinched. It's really just inflammation. We do have situations sometimes where people have really large disc bulges or disc herniations in their neck that can mechanically impinge on the nerve. But in most cases, it's really just inflammation and irritation around the nerve roots coming out of the neck that gives us this nerve pain. So just something I want to clear up before we get into exercises. I think it's helpful for most people to know in most cases your nerve is not actually pinched. We just want to work on desensitizing the area and reducing pain. For the first exercise, we are going to massage our cervical extensor muscles. When people have nerve pain coming from the neck, oftentimes these muscles on the back side of the neck will spasm and tighten. So I like to use a yoga block like this. I'll put a link down in the description if you need one of these, and then you're going to use a massage ball. What we're going to do here is put it right behind the neck and kind of use that yoga block to hold the ball, and then we're just going to work through the muscles on that side of the neck where your nerve pain is originating from. So if the pain is going down my right arm, I'm primarily going to focus on massaging the muscles on the right side of my neck. So I'm kind of working through that whole region, looking for tender points. If it hurts to hold your head, you can take your other hand and kind of support it here. Sometimes people experience pain when they're trying to use their muscles to hold their neck or hold their head up. So just work your way through there. Those muscles are right on the side of the spine, so you're not pushing right in the center, you're just off to the side. If you find a tender point, you're just going to pause on it and kind of think about just taking some deep breaths and letting those muscles kind of relax. The nerves are coming out right near the muscles, and again, we'll often, when we're working on people and feeling their necks, we'll find spasms in these muscles when their nerves are flared up. So first, just kind of work on releasing this area. This will help to reduce pain and reduce muscle tension. For the next 2 exercises, I'm going to use a long black foam roller like this. You can have a black one, there are white ones out there. It doesn't really matter a lot. The black one is a little more firm, so it can be a good one for mobilizing our joints. If it's too hard, if you feel like maybe you're extra sensitive, the white foam roller is a little softer, might be a better starting point. So for this first exercise, we're going to lie this down on the ground. I'm going to sit in front of the roller, kind of hold on to it, and then lie back. With this exercise, we're going to be mobilizing the thoracic spine, the middle part of our back. So use your hands to hold your head. Again, when people have nerve pain, usually holding their neck like this with their neck muscles will cause pain. So just support your head with your hands. And then what you're gonna do is lift your butt up and just roll along this roller. And again, we're mobilizing the joints of our thoracic spine, that middle region of our back. The upper part of the thoracic spine biomechanically functions alongside our neck. And what we'll find is that a lot of people are stiff in their upper thoracic spine, kind of in between their shoulder blades and up a little bit higher. So if we can loosen that area up, it will often help to reduce neck pain and allow the neck to move more freely. So just kind of work through here for 1 to 2 minutes. If you find something that's kind of extra tender, you can kind of pause on it. But you're just basically rolling up and down through here. Sometimes the spine will pop when you do this. That's okay. It's just sort of just kind of like a little cavitation, a little pressure release in the joints, and oftentimes that can help to also reduce some pain. Okay, so that is the second exercise, a thoracic mobilization. For the next exercise, we are going to rotate the foam roller so that it's running vertically. For this one, I'm going to sit on the roller and have my whole spine positioned so that it can rest on the roller all the way from my tailbone to my skull. So my neck should be really resting here. And then we're going to do something that's called an angel. So I'm just taking my arms out to the side through abduction and then up overhead. This exercise is normally used for shoulder mobility, but something that I've found that's really helpful about it with patients with nerve pain in the arms is that this movement helps to also mobilize the 3 big nerves that go down our arm. They all start in the neck and then run down the arm. So the median nerve the ulnar nerve, and the radial nerve. As we lift our arm up overhead through full range of motion, it stretches the nerves. They come out of our neck, and they run through our armpit and then down the arm. So this can often be a really good exercise and starting point for people with nerve pain that is coming from the neck and going down the arm. So for this one, go for 10 to 15 repetitions, and this is one that you can do several times throughout the day. Maybe you shoot for 3 to 5 sets of this throughout the day to help work on shoulder complex mobility and nerve mobility. The last exercise will be a more specific nerve mobilization. As I mentioned, the angel can be a good starting point, especially when your symptoms are a little more flared up. As things go along and maybe your pain is calming down a little bit, you can start to try these nerve mobilizations. So for this one, I'm going to pretend like my right arm has the nerve pain. I'm going to put my arm out so that I have a 90-degree angle at my shoulder, and I'm going to start with my elbow straight. I'm going to extend my wrist and fingers, and when I do that, it's going to put a stretch on my nerve. So to take a little bit of that stress off the nerve, I'm going to move my head towards my arm, which loosens the nerves up here at my neck. Now I'm going to alternate, so I'm going to bend my wrist and elbow, which loosens the nerve down there, and then I'm going to move my head away, which is going to tighten the nerves up here at my neck, and then I'm just going to go back and forth. So this is called a nerve mobilization. Sometimes we call this nerve flossing. Sort of like flossing your teeth, I'm pulling the nerve back and forth, down towards my wrist and hand, and then up towards my neck. It's just helping to get that nerve moving. We have research showing that this also helps improve blood flow to our nerves and can help, again, reduce pain and improve nerve health when we have something like a pinched nerve kind of filling in our neck. So for this, go back and forth 10 to 15 times, sort of like the angel. When you're done, just take a little rest. You can do more of it right then, or what works for most people is just a few hours later, go back to it later in the day. Maybe again, think about doing this 3 to 5 times a day. You really just have to experiment with it though and see how your symptoms respond. If your nerve flares up, then just wait till the next day, take some time off, and just kind of figure out what works best for you. Thanks for checking out today's video. I hope you find the exercise in this video to be helpful. Just want to mention that my book does have a more comprehensive program for nerve pain that radiates from the neck. Each body region has its own chapter in my book. So if we go to the head and neck chapter, we'll find this nerve pain program. As you can see, talks about how the pain starts in the neck, radiates down the arm, talks about disc bulges and disc herniations. All of the programs in my book have 3 phases and have pictures of me doing all the exercises. Essentially, the program guides you through a complete physical therapy rehab program so that you can do your own rehab at home. So if you'd like to have a resource like this at home that allows you to manage your own pains and injuries, I will put an Amazon link for the book down in the description. Thanks again for checking out today's video. I'll see you guys in the next one. Bye.